I'm talking to Professor Richard White, paediatric nephrologist, appointed to Birmingham Children's Hospital in 1965 and who was in the department till 1991. Richard, can we just talk about why you chose to specialise in paediatric nephrology?
Yes, it started, oddly enough, with the liver. I'd learned how to do liver biopsies when I was at the Brompton Hospital, and I got interested in instruments, and I devised a modification of the Silverman needle to make it easier to biopsy children of different ages, because of course livers in children are mostly infants. And then in 1954, I think it was, Robert Kark and Murky in Chicago wrote their classical paper on renal biopsy in the prone position. And I thought, now I've learned how to use a needle, why don't I do that as well? That's how I got interested in it. When I got to Great Ormond Street as senior registrar in 1958, there was great opposition to doing anything like that. The physicians thought it was dangerous, and the pathologist said that it's not possible to get as much tissue from a needle biopsy as you can from an open biopsy. But I was saved by Alan Moncrief, who was the professor of paediatrics in London University, the only professor, and he really persuaded the rest of the physicians to agree and encouraged me. They had one condition, that was that I must do it under general anaesthetic, which was not really a very good idea. But anyway, that's how I started, and I can go on from there. But I got interested in the pathology because it was no use just sticking needles in and leaving it. And I always used to look at the biopsy specimens, and I got interested in nephrotic syndrome in particular. A study was being set up by Walter Holland, epidemiologist at St Thomas's, and Ronnie McKeith, one of the paediatricians at Guy's, in the southeast, what was then southeast regional region, and the southwest. So that covered Kent, Sussex, Surrey, Hampshire, and so on. And I was prepared to go out to all the regional centres to do biopsies because the paediatricians were a bit possessive in those days, and that's what I did. And so this started the embryo of a renal service at Guy's Hospital, where I was at the time. That went quite well, and so I followed the same pattern when I came to Birmingham in 1965, approached the various paediatricians and persuaded them that if I came out to see patients there and do biopsies, they might be interested. And that's how it started, and eventually the workload got such that we then had to ask the paediatricians to send the patients in to BCH.
So Richard, thinking back, how do you think, or what is your recollection of how paediatric nephrology developed over the first 10 to 15 years of your career?
I think one of the important things was the International Study of Kidney Disease in Children, ISKDC. I met Henry Barnett when he was on a sabbatical in London, and he told me about his plans to develop that. And we had our first meeting in London in 1966, July 1966, I think it was. And we were looking really at nephrotic syndrome and three of us, René Habib from Paris, Jack Churg from New York, and myself, were made pathologists for the ISKDC. And this for me was a great thing, to work with these other two giants of paediatric nephrology. But the ISKDC proved to be the stimulus, particularly to Gavin O'Neill, to start a European society. And I think that was an important step. Other than that, dialysis and transplantation was developing in the UK, particularly at Guy's and in Manchester and Glasgow were the three main centres. Birmingham was afflicted by bureaucratic problems, and it was a long time before we were able to get anything going. When we appointed Michael Winterbourne to East Birmingham Hospital in 1979, he started work alongside the adult nephrologists there and got dialysis going, but transplantation was only done occasionally by an adult surgeon at the Queen Elizabeth Hospital. So it was a long time before proper dialysis and transplantation was going in the Midlands. I think those are the main developments. We did a lot of there was a lot of interest in reflux nephropathy, urinary tract infection, and on my side there was a lot of interest in glomerulonephritis, Henoch-Schönlein purpura and nephrotic syndrome, because of my interest in renal biopsy, which I continued forever.
Richard, in reflecting back over your career, could you perhaps talk about the major contributions that you felt you made to paediatric nephrology?
Yes, well, I suppose the first one to mention is renal biopsy and renal pathology. I did quite a bit with colleagues on improving the renal biopsy technique, and towards the end of my career we worked out that doing biopsy on a day case was as effective and perfectly safe as admitting the patients. My interest in renal histology continued throughout my career, and I think I probably made some contributions in subjects such as acute post-streptococcal nephritis, Henoch-Schönlein purpura, nephrotic syndrome, and latterly hereditary nephritis, Alport syndrome in particular. The other area of interest to me, in which I was able to contribute, was reflux and reflux nephropathy and urinary tract infection in general. I had in the early days done some studies in the community of bacteriuria in primary school girls with Roy Meadow as one of the researchers, and this led to an interest in urinary tract infection in general and onto reflux, and we set up a very big study with Mark Taylor and surgical colleagues to investigate, to compare surgical treatment with conservative management of reflux, and we published a couple of good papers on that. On coming back to biopsy, the reflux nephropathy gave us an interest in the effects of reduced renal tissue and its effect on the glomeruli, with enlarged glomeruli, and the development of segmental sclerosis, and we did quite a lot of biopsy studies with this, particularly with the help of Japanese colleagues. I had 4 Japanese researchers and was able to travel to Japan myself on 3 occasions professionally. And so I think that this was another contribution that I feel fairly proud about. Finally, I was involved with Noel Rain, the late Noel Rain, the head of biochemistry during my time, and we looked at alternative ways of measuring proteinuria. Martin Barrett had looked at albumin over creatinine ratios, and what we did was to look at protein over creatinine, total protein, which was much cheaper and quicker to measure. And we had some very good comparisons with 24-hour collections and so on. And this was then weaved into our routine use for the rest of our time, and I think it still is probably.
So Richard, you were one of the people at the first meeting of the ASBN in Glasgow in 1967. What are your recollections of the time leading up to that meeting and of the meeting itself and its impact?
There was quite a lot of resistance in the early 1960s to the idea of specialisation within paediatrics. Amongst some very senior, eminent consultants, but there were a few visionaries like Alan Moncrief, for instance, and also in Birmingham, Douglas Hubble, who was Professor of Child Health there, and was determined to build up specialties because, as he said to me, if we don't do this, we will always be dominated by the adult physicians. I was, before I left Guy's Hospital to come to Birmingham in 1965, I had met with Harman Tiddens. I had been over to Utrecht to meet him there earlier on, and then he came over to Guy's. And we talked a lot about the need for a European society. I was not in a position to be involved at that time because of my impending move to Birmingham. Harman got in touch with Gavin Arneil in Glasgow, who had done a limited amount of nephrology, in particularly collecting a huge number of nephrotic children and studying them clinically, so they got together and decided that they would set up the European Society of Pediatric Nephrology, and the first meeting was held in Glasgow in September 1967. The second meeting, incidentally, was held in Utrecht, which was a fair deal between Gavin and Harman. The first meeting was interesting. The scientific papers were all short 10-minute papers and were of relatively unsophisticated level compared with today, although there were one or two people doing ultramicroscopy from Europe. I think it was good for us to meet up with all these people from Europe. I had no idea that there were so many people in various European countries who were doing nephrology. It was good to get to know them and meet them. We had quite a nice social programme up in Glasgow as well. We were taken on a bus tour along the edge of Loch Lomond, which was very scenic. I have a good memory of a dinner party in Gavin Arneil's house, at which he did the traditional thing of reciting a bit of Robbie Burns and then stabbing the haggis with a sharp knife. So it was good. We had fun, and I think we all felt that the opening meeting set the tone for the development of the society, and I think we all felt the need for this association, because the only other international group really was the ISKDC, which was focused on a particular area, and there was a lot more nephrology than that to be dealt with.